Most men grow up believing that orgasm and ejaculation are the same thing, but they're not. They're two separate biological processes that just happen to overlap most of the time. When you learn to separate them, you can experience multiple, full-body orgasms without the usual crash or loss of energy afterward. I'm Dr. Nora Vale, a urology and men's health expert. And in this lesson, I'm going to teach you how to begin developing that control safely, mindfully, and with real physiological understanding. We'll walk step by step through how to experience a non-ejaculatory orgasm, why it works, what to expect when you first practice, and the common mistakes that make men lose control at the crucial moment. This is a skill, not a trick, and it's one that any man can learn with patience and awareness. To begin, let's talk about what's actually happening inside your body during arousal. Orgasm is a neurological and muscular release governed by your nervous system. Ejaculation, however, is a reflex involving contractions of the pelvic floor and prostate. When most men climax, both events happen together. The nervous system fires, pelvic muscles tense, the prostate contracts, and semen is expelled. But if you train your awareness and control of tension and timing, you can allow the orgasmic release to occur without triggering the ejaculatory reflex. The experience feels very different. Instead of one quick burst followed by a refractory period, you get waves of pleasure, full body sensitivity, and the ability to stay aroused afterward. Let's first look at how most men approach stimulation. It's a fast, sharp climb. Speed increases, pressure builds, muscles in the pelvis, thighs, and abdomen tighten, and the mind becomes flooded with sexual imagery or the goal of finishing. The nervous system becomes highly sympathetic, fight or flight, and the body reaches a tipping point. The pelvic floor locks, the prostate contracts, and ejaculation happens. To separate orgasm from ejaculation, you need to reverse this pattern. You slow the buildup, you reduce tension, and you bring the nervous system into a calm, parasympathetic state, even while you're aroused. This state allows the body to release pleasure without triggering the reflex. Here's how to practice. Start alone, in a relaxed, private setting. Empty your bladder, wash your hands, and take a few minutes to breathe deeply through your nose. In for 4 counts, out for 6. Apply a small amount of water-based lubricant so that friction never pulls you out of focus. Lie on your back, or recline comfortably so you can fully relax. As you begin stimulation, move slowly and mindfully. You're not chasing a peak, you're cultivating awareness. Feel the sensations rising through the pelvis, but keep your breathing steady. If you notice tension in your legs, abdomen, or jaw, release it immediately. The pelvic floor should feel soft, not braced. You're aiming to reach the edge of ejaculation without crossing it. As you sense that point approaching, the familiar pressure and inevitability, reduce intensity even further. Think of it like surfing a wave rather than sprinting to a finish line. The moment you reach the very edge, stop all stimulation and let your body go quiet. Keep breathing. If you time it just right, the wave will roll through you as an orgasm without an ejaculatory release. You'll feel contractions, warmth, and pulsing energy, but you'll remain hard, clear, and energized afterward. If you cross the line and ejaculate, it's fine. That's feedback. Next time, stop a fraction earlier. If you stop too soon and nothing happens, ease back up more gradually. This learning process is how your nervous system refines control. There are 3 cues that make this practice much easier. First, relax your feet and toes. Tension in the feet often mirrors pelvic tension. Second, remember the feeling of relaxing to urinate. That deep letting go in the pelvic floor is the same release you want during stimulation. Third, quiet your mind. When you approach orgasm, stop visualizing, stop fantasizing, and drop fully into sensation. Let awareness move into your chest, belly, and pelvis. The quieter your thoughts, the less likely your body is to trigger the automatic reflex. While you practice, stay mindful of your breathing. Breathing through your nose slows your heart rate and stabilizes the nervous system. When you reach the edge, take one long inhale and an even longer exhale, perhaps letting a natural sigh or low sound escape. The vibration of the exhale keeps energy moving through the body rather than concentrating only in the genitals. Many men notice that this simple breath keeps them in orgasmic sensation much longer and prevents ejaculation from firing. You should expect some variation at first. Sometimes you'll feel a gentle ripple of pleasure rather than a peak. Other times, you'll have an intense, full-body wave that leaves you tingling and wide awake. Occasionally, a small amount of fluid will leak out. This is prostatic fluid, not a full ejaculate, and it's harmless. As long as you remain erect and energized afterward, you've achieved a non-ejaculatory orgasm. Over time, your body learns to extend these waves, sometimes for several minutes, and to circulate the pleasure through your abdomen, chest, and even your spine. If you choose to integrate this into partnered intimacy, communicate with your partner and take things slowly. It's easier to learn alone because you control pace and stimulation, but once you're confident, you can apply the same principles together. Positions where you control depth and rhythm make it easier to pause and breathe when needed. You may need to stop motion briefly at the edge, take a deep breath, relax, and continue at a slower tempo. This not only improves your control, but also deepens the emotional and physical connection with your partner because you're both fully present instead of racing to finish. There are a few important cautions. Don't force anything. If you experience pain, sharp discomfort, or a feeling of pressure that doesn't ease with relaxation, stop and take a break. If you have chronic pelvic pain, prostatitis, or recent surgery, discuss any new practices with your clinician before experimenting. Never use excessive force or constriction devices to try to hold back ejaculation. That can cause injury. Control should come from relaxation and awareness, not clenching or gripping. A word about porn and overstimulation. Avoid it for this practice. Pornography overstimulates the visual centers of the brain, floods dopamine pathways, and creates a reflexive rush toward ejaculation. To learn non-ejaculatory orgasm, you need a calm, embodied mind. Focus on what you feel, not what you imagine. Music, breath, or quiet can help you tune in. Let's recap the steps clearly so you can practice safely. Step 1. Set a quiet environment, relax, and breathe slowly. Step 2. Use gentle, mindful stimulation and stay aware of tension. Step 3. As you approach the point of no return, slow down even further, then stop completely. Step 4. At that edge, take a deep breath, exhale, and let the body release naturally without moving. Step 5. Remain still and present through the wave. If you overshoot, learn from it. If you undershoot, get closer next time. Over several sessions, you'll discover the precise moment where you can relax through the wave instead of triggering ejaculation. With consistent practice, 10 to 15 minutes, 2 or 3 times per week, your body begins to rewire. You'll find you can stay aroused longer, recover faster, and experience a more centered form of pleasure. The nervous system becomes more sensitive, not less, and your confidence grows. Eventually, the orgasms become whole-body events, rather than localized contractions. You may notice pulsations moving upward along the spine, through the chest, into the head. This is the nervous system learning a new pattern. Finally, keep realistic expectations. Non-ejaculatory orgasm is not a competition or a party trick. It's a way of cultivating deeper awareness and control over your body. Treat it as meditation rather than performance. With time, patience, and calm curiosity, you can experience sustained, powerful pleasure without depletion. If you try this tonight, focus less on succeeding and more on noticing. How much tension do you carry in your pelvis? How easy is it to breathe at the edge? These awarenesses are progress. Within a few weeks, many men find they no longer feel hostage to reflexes. They can enjoy sex or self-pleasure from a place of calm mastery rather than anxiety. So, in summary, slow down, breathe deeply, relax the pelvic floor, approach the edge, stop, and let the wave move through you. Practice in short, patient sessions. This is how you retrain your body to separate orgasm from ejaculation, preserve energy, and enjoy more control and confidence in every part of your sexual life. I'm Dr. Emma Blake, and I hope this helps you begin that journey toward full body awareness and satisfaction.